Happy Labor Day, everybody. I hope you're doing well. This is Dr. Winnie, and I wanted to share with you what I'm fixing for today and see what you guys are fixing. So I'm going to be making some cabbage, and I'm going to show you. There it is. It's cooking up. And I'm going to also have some nice, delicious ribs that are the fall off the bone type. So you can see that they're right here in the oven cooking. These are the kind that take a long time to prepare but I want to know what you guys are fixing for today. So let me know in the comments. I'd love to know. Once I get everything done, I'm going to show it to you again so you'll see exactly what it looks like. But I did want to take a moment and talk with you about something that I think is rather important. You know, I'm a real doctor. I have a medical practice at the King Wellness Institute in Spring, Texas. And one of the things that I do is hormone replacement. We do bioidentical hormone replacement. And I know many of you have maybe heard about hormones and said, oh no, those are dangerous. They cause cancer. Well, that's simply not true when you're talking about bioidentical hormones, because those hormones look just like the hormones that your body used to make. So if they were going to cause cancer, you'd have had cancer a long time ago because they're just like the ones that you made. They are not synthetic. They are manufactured by compounding pharmacies to look just like the hormones that your body naturally made when you were younger. And you know, by the time you turn 30, your hormone levels start to drop. That's normal. And by the time you're in your 40s, 50s, 60s, and beyond, your hormone levels are low. And so once that happens, you start to feel the symptoms of hormone deficiency. They include low sex drive, irritability, gaining weight, not sleeping very well, mood fog, you know, where you just don't quite feel yourself. You know, you're feeling overwhelmed, maybe a bit depressed, tearful even. And this can happen to men as well as women. And we confirm this by a simple blood test. Your insurance, if you have insurance, will cover it. If you don't, we've got a very, very affordable price for it. I just charge you what the lab charges me, and so it's very affordable. And then once we know, the numbers don't lie, and then we can talk about replacing your hormones. And we do that with a little pellet. It's about the size of a grain of rice, and it goes right under your skin, on your lower back or on your hip. Nobody knows it's there, and in about a week's time, you're going to start feeling like your old self again. I think it's important for you to know about the benefits of this. Now, of course, the sex drive goes up, your mood, your sense of self, the calmness, all of that gets so much better. But there are also some real health benefits associated with it. We know statistically people who receive bioidentical hormones live longer. They just do. We know that the risk for Alzheimer's disease goes down when you're getting bioidentical hormones, and your risk for osteoporosis, which is thinning of the blood, thinning of the bones, also goes down. So these are some real health benefits that I, as a physician, am excited about for my patients. But of course, the clinical benefits are just off the chart. I've been getting these bioidentical hormones, gosh, for about 7 years now, and I'll never be without them because I feel so fabulous, and I know that you will too. So the first thing to do is to start out with blood work. The labs don't lie. It tells you the story, and then we can talk about the hormone replacement. This is very different than synthetic. A lot of you guys maybe have been getting the testosterone shots, you know, where you have to give yourself a shot every week or 2 weeks. You feel good for a minute, then you don't. Up and down, up and down. With bioidentical hormones, these will last men up to 6 months. You don't have to do anything. Once I put them in under your skin and it's painless, we numb you up, then you're good to go. With women, those hormones will last you up to 4 months. Don't have to do anything. They just do what they do. So this is something that I think you need to know about and take advantage of. There are some real benefits to it, not only in terms of your overall health, but the quality of your life. And as you get older, it's so important to do the things that's going to give you joy, make you feel better, not feel sluggish and slow and depressed and sad. And bioidentical hormones can absolutely do that. So if you'd like to know more about it, just call me, call my office, and we'll get you on the schedule, get an appointment for you, and then just see what we can do to help. My office number is 281-547-8870. And I'm located right on Louetta Road, just a few miles down from I-45, very easy to reach. So anyway, now I'm going to take my doctor hat back off and I'm going to put my cook hat back on, and we're going to finish up making the cabbage, and we're going to have the ribs. I actually have a ham hock in my pressure cooker that's also cooking, because I like to put a little pork in the cabbage as well. So when we come back, you're going to see all of that put together. So I'm back, and we've got everything completed. So I want to show you what I have. Now, I also decided that it just wasn't enough food, so I decided to go ahead and make some macaroni and cheese too. All right, so here we go. We've got the ribs, and as you can see, I started to cut them so you can kind of get an idea. I don't want to touch them too much because they're so fragile, they fall off the bone type. And then we've got our cabbage with some pork in there, and I just decided to go ahead and make some macaroni and cheese just to add an extra item to the dinner meal. So that's it. I'm going to pack it all up and head over to my family, and we're going to have a nice Labor Day meal. I hope you guys are having a wonderful day. Please be safe. You know, sometimes people drive under the influence, and I don't want anything to happen to you, and don't you do it either. So take care, and I'll see you next time. Bye-bye.